Hello, friends. So we are back with tips in neurology, that is 10 important points. And today I'm going to discuss a very important and common condition, unfortunately, and that is herpes zoster. So you may have come across people who get this kind of blisters on the skin or skin lesions, and very often they have pain also. And so basically, what is this condition? So this herpes zoster, it occurs due to number first point is reactivation of the dormant varicella zoster virus. Now varicella zoster virus is the same virus that causes chicken pox in children and herpes zoster in adults and older people. Now the second point is, why does this virus become, from dormant state to reactivated state? And that is assumed to be due to poor immune mechanisms or a drop in the defense mechanisms of the immune system. So that is why it can be seen more commonly in people who have cancer, or those who are taking chemotherapeutic agents, or those who are on other immunosuppressive drugs, diabetes which is not under good control. So these, and also in older people it is more common. So that brings us to the third point. So what is this, how common is this condition? So if you look at the incidence, it is 1 to 3 per thousand population in younger people, and from 4 to 12 per thousand population older people, which is age above 65 years. So as per estimates, out of 1 out of 3 people in their lifetime develop this herpes zoster infection. Now, so the next point is, can it spread from person to person? So the answer is that usually if somebody has already had chicken pox in the past, then that person is immune to it. But someone who has not had chicken pox, if they come in the contact with the blisters, then the virus can spread. And also sometimes it can spread through the respiratory droplets. So, but they will not get herpes zoster; they'll get chicken pox, and that is how it spreads. Then the sixth point is, which parts of the body can get affected. So it usually occurs on one side of the body in a single dermatome, but so if you look at the common sites, the most common is the thoracic or the trunk dermatomes, followed by the cervical, and then the trigeminal, which is the face, and finally the least common is the lumbar, which is the buttocks, thighs, and the legs. So these are the common areas where herpes zoster can occur. And then the next is, what are the three phases? So basically, in the first phase, which lasts for about 48 hours, the person doesn't have skin blisters, only the pain is there. And then after 48 hours, usually the blisters will start on the affected area and pain continues. And that can go on for 2 to 4 weeks also. And then the third phase is the chronic phase, where the blisters have already healed, but the pain can remain, and that can remain for a long time also. So, what is the complication? What we look at? The most common complication is something called as post-herpetic neuralgia, where the pain in the affected region can last for more than a month, and it can go on for several months or years also, and that is quite disabling because it is annoying. It affects their sleep. Many of them can have anxiety also because of the severe pain, and it doesn't. They cannot do their normal daily activities with peace of mind. And in the acute phase, some people may have other complications like meningitis, encephalitis, or it can involve multiple dermatomes or more widespread infections, but those things are not common. And then finally, ninth point is, how do we treat this condition? So basic treatment is by using antiviral agents like acyclovir, and that and other antiviral agents. And then and which brings us to the last point. So can we prevent it? So definitely there is a vaccine for preventing this herpes zoster, and it is recommended or advised to be taken by people who are above 50 years. There are two doses which are given within a gap of say 2 to 6 months. And then in people who are younger, say 19 or above, also sometimes if they are immunocompromised or if they have poor immune mechanisms, then some of them also can take this. Now, so that brings us to this end of this topic. But I would like to remind you that this information, what I have mentioned, they are general in nature and don't apply to everybody. So always, when you have this problem or when you want to take the vaccine, talk to your physician and then proceed for the treatment and the vaccination. But important is to recognize this disease once somebody gets it, and meet your dermatologist or physician or neurologist as early as possible, So that because early treatment can prevent many of the complications that we see, and also it will help in faster healing.